First manual muscle test that we are going to go through is the shoulder flexion. This is accomplished through a patient just flexing their shoulder. So for a manual muscle test level 3, the patient would be able to just perform it against gravity all the way up in full range of motion. And that's good. In order to get a 4, the patient would bring it to half flex, like so, and then I would push against them and they would break away. And that would be a 4. And then if it wanted to be a 5, you put the patient at partial flexion, push against them, and if they were able to sustain resistance, that would be a 5. In order to eliminate gravity for this exercise, you would have the patient lay down flat on the couch. I'm going to have you go on your right side, facing me, to eliminate gravity. And then you'll be flexing out like so. Just flex forward, and that would be a 2. If the patient was not able to accomplish that motion, then you would palpate the shoulder flexors up here, and then she would attempt to do it. And if you felt a contraction, that would be a 1. If there was no contraction, then that would be a 0. The next manual muscle test that we are going to go through is shoulder extension. This is accomplished by a patient standing up. They would just be able to move their arm backwards like so, as far as they can go, and that would be considered a 3. If they wanted to do it against gravity, well, this is gravity limited currently, but we would be able to test for levels 2 and 1. If they were able to perform this action like so, that would be a 2, so then the 3 would be coming later. But if they were not able to move it backwards, and then you would palpate the shoulder flexors back here, and if you felt a contraction, then that would be considered a 1. If there was no contraction, that would be a 0. In order to get gravity to perform the action against gravity, you would have the patient lay face down onto the table, or in this case, the couch, and have her arm behind you like so, and then go through shoulder flexion like that. That would be against gravity, so that would be a 3. And then you would leave them in a partially flexed position, push against it, and if they were to break away, that would be a 4. If they were able to sustain the pushing against them, then that would be a 5. The next exercise that we're going to go through is shoulder abduction. The way to accomplish this against gravity at a normal level is just have the patient standing upright and then have them raise their arm out to the side. So you can go ahead and raise your arm out to the side like that. Good, that would be a 3. And then if you would have them leave it at a partially flexed position and apply pressure, if they break away, that is a 4. If they were able to apply the pressure and maintain the contraction, that would be a 5. In order to accomplish this exercise gravity eliminated, you would have to put the patient onto a floor or a solid surface. I'm going to have her lay on the floor for this. And then she would be able to perform the exercise of bringing it out, and that would be gravity eliminated. Since she's just able to perform it, that would be considered a 2. But if she were not able to perform it, then you would palpate the area of the shoulder abductors, more specifically the deltoid, and then I would ask her to go for it. And if I felt a contraction, that would be a 1. If there was no contraction, then it would be a 0. The next exercise we're going to be doing is horizontal shoulder adduction. In order to accomplish this, the patient will place their arm out at the side and then bring it towards the center of their body, abducting it like so. That would be considered a 3 because they're able to make it all the way through the range of motion against gravity. If you were to put them in a partially flexed position and apply pressure to it and they broke away, that would be a 4. If they were able to sustain the contraction like so, that would be a 5. In order for to eliminate gravity in this sense, you'd have the patient stand up and then have them hold their arm out to the side and bring it to the middle. If they're able to accomplish that, that would be considered a 2. And if you're not able to accomplish that, then you would palpate the area to look for a flexion. And if you felt a contraction, then that would be a 1. If there's no contraction, then that would be a 0. The exercise that we are going to be doing is shoulder internal and external rotation. In order to accomplish this exercise, you would have a patient lay down to go against gravity, and then you would have them put their arm out to the side like that. That would be external rotation. To bring it back in would be internal rotation. And then you would have to lay on your back in order to do external rotation, so we'll get to that in a minute. But in order to do internal rotation against gravity, since she was able to perform it in the full range of motion, that would be considered a 3. If she were to put her arm out to the side for internal rotation, put it in a partially flexed state and press against it, she breaks away, that would be a 4. Press against it, she sustains it, that would be a 5. In order to eliminate gravity in this sense, you would have the patient stand up and have her hold her arm out like so and bring it in. That would be considered a 2 since she's able to go through the range of motion. And if she is not able to complete the motion, then you would test the internal rotators of your shoulder for a contraction. If you are able to feel a contraction, that is a 1. If you are unable to feel a contraction, that is a 0. Going back to external rotation, we're going to have you lay back on your back and just make sure we accomplish this and then we're going to bring your elbow out to the side like so, and then you're going to be rotating your arm out like that. So bring it down flat like this and just bring it up. That would be considered a 3. Leave it in a partially flexed state. Pressing against it, breaks away, there's a 4. Sustain the contraction, that would be a 5. So on and so forth. And standing back up with the gravity eliminated. If she was able to bring it back out against gravity eliminated, that would be considered a 2. If she was unable to complete it with gravity eliminated, that would be a 1 if you felt a contraction when the external rotators are in the back of the shoulder. And if you do not feel any contractions, that would be a 0. Next exercise that we are going to go through is wrist flexion and extension. So in order to perform this exercise, gravity eliminated, you would have the patient lay flat on the table, make sure that the wrist is in an upright position, not so that you don't have to work against gravity. And then I would ask her to go in a flexion state, like so. That would be considered a 2 if she was able to move the normal range of motion. If she is unable to perform the normal range of motion, you would palpate the forearm on the posterior side of it and feel for a contraction in there. If you felt a contraction, that would be considered a 1. If you did not feel a contraction, that would be a 0. In order to do this exercise against gravity, you would simply have the patient rotate their arm to the upward position and then ask her to do wrist extension. And that would be good. If she was able to perform that against gravity, that is a 3. And if she was put in a partially cocked position, probably break away. If she broke away, that would be considered a 4. If she was able to sustain the contraction, then that would be a 5. Similarly, if you had the patient putting against gravity eliminated for wrist flexion, you just simply have them have their wrist in the upright position, pull in like so. That would be considered a 2. If they are unable to do it, then you palpate the inner parts of their forearm for a contraction. If you felt a contraction, that would be a 1. If there was no contraction, that would be a 0. If you are able to go against gravity, simply have them pronate their arm and then go ahead and do wrist flexion there. She's able to go against gravity, so that would be considered a 3. If she's able to resist against me but then breaks away, that would be a 4. If she's able to resist and sustain the contraction, that would be a 5. The next exercise that we are going to be going over is elbow flexion. In order to accomplish this against gravity, you can simply have the patient bring their arm out to the side and bring their forearm up. That would be able to accomplish against gravity. Therefore, that would be considered a 3. If you put them in a partially flexed condition and push against them, they break away. That would be considered a 4. If they're able to sustain the contraction and keep my hand and the pressure on, that would be considered a 5. But if they were unable to perform the 3, you would have them lay on their side and have you lay on this side and use this arm for the next one. Or you can flip the other way, whatever works best for you. Ty, can I have you come over here so you can top move it? And then for this part of it, you would have the patient flex their arm upward like this to do gravity eliminated. If they're able to perform that action, that would be considered a 2. If they aren't able to perform that action, then you would have them try and contract it, and you would feel for any contractions that are going on in the muscle. If you were able to feel a contraction, then that would be considered a 1. If there's no contraction, then that would be a 0. Moving on to elbow extension, you would have the patient lay flat on the table, just like straight flat. Wonderful. And then you would have them raise their arm into the air like so, and have Britt go into flexion right now. And then for extension, you would have them bring their arm up all the way. So just go ahead and flex your tricep. Good. That would be considered a 3 because it's against gravity. If they're able to perform it against gravity and then you add in resistance and they were to break away, that would be considered a 4. If you're able to put on resistance and they stay contracted, then that would be a 5. In order to do this exercise gravity eliminated, you would have them flip back onto their side, like so, and have them go into an extension phase, so go ahead and extend. If she's able to perform the motion, that would be considered a 2, but if she was unable to, then you would have her come back into this motion and attempt to contract, and then you would feel for a contraction in the tricep muscle. If you're able to feel a contraction, that is a 1. If there's no contraction, then that is a 0. So the next exercise we're going to be going through is radial and ulnar deviation. We're going to start with radial deviation. In order to perform this exercise against gravity, you can have the patient laying flat on the table, make sure that their arm is in an upright position, and just have them go through radial deviation. Since she's able to perform this against gravity, that would be considered a 3. If you're able to put her into the deviation and then push against it, she broke away, that would be a 4. If she was able to sustain the contraction, that would be considered a 5. If she is unable to perform it against gravity, you would have her flip her arm into the inside, and then you would have them deviate to the side like that. They're able to perform it, so that would be considered a 2. But if they were unable to, then you would be able to palpate onto the muscles that allow for deviation. If you felt a contraction, then that would be considered a 1. If there was no contraction, that would be a 0. Moving on to ulnar deviation, you can position the patient up like so and have them armed in the air, and then you can just have them do ulnar deviation against gravity. That would be considered a 3. If they're able to do it against gravity with resistance but they break away, that would be a 4. If they're able to do it against gravity with resistance and sustain the contraction, that would be considered a 5. In order to do it with gravity eliminated, very similarly, you just have them lay their hand flat on the table, and then you can have them deviate to the left or to the outside. If you're able to perform this, that would be considered a 2. If you're unable to perform it, you would feel for a contraction. If a contraction was present, that would be considered a 1. If there was no contraction present, that would be considered a 0. Next exercise that we are going to be going through is thumb flexion. We're going to start with having our patient bring her arm into this. In order to perform it against gravity, you would just be able to flip the patient's hand over like so and have them pull their thumb against gravity like that. That would be good. If you're able to pull against it at partial contraction and they broke away, that would be considered a 4. If they're able to sustain the contraction like so, that would be considered a 5. If they're unable to perform this against gravity, simply have them open their hand and attempt to move their thumb back to the inside. If they're able to perform that exercise, then that would be considered a 2. But if you're not able to, then you would palpate for where the contraction would occur. If you feel a contraction, that would be considered a 1. If there's no contraction, that would be a 0. Similarly, for thumb opposition, you would be able to perform this exercise against gravity by asking the patient to put their hand upright and move their thumb upwards, like so. If they're able to perform that against gravity, that is considered a 3. If they're able to perform it against gravity and push away for a little bit, but then they break away, that would be considered a 4. If they're able to perform it and they sustain the contraction for a while, that would be considered a 5. If they're unable to perform it against gravity, they can simply open their hand up like so, and then I'm going to have you oppose your thumb like that. This is gravity eliminated, so that would be considered a 2. If they're unable to perform it, you would palpate the thumb extensors on the back side of the hand, and then you would, if you felt a contraction, that would be considered a 1. If there was no contraction, that would be a 0. Next exercise we are going to be going through is finger extension and flexion. We're going to start with extension. So in order to perform this exercise against gravity, you can simply have your patient begin with your finger closed up. Then you can say, can you extend your finger? Do it like so. They'll be able to perform the exercise, the full range of motion. That would be considered a 3. If they're able to perform it against resistance, but then they break away, that would be considered a 4. If they're able to perform it against resistance and they stick around, that would be considered a 5. If they were not able to perform it against gravity, you would have them pronate their hand like so, and then you would be able to ask them to flex out their finger like so. Gravity eliminated, that would be considered a 2. If they're unable to do so, then you would palpate the top part of their hand and ask them to try and contract. And if you felt a contraction, that would be considered a 1. If there's no contraction, that would be considered a 0. For finger flexion against gravity, you can simply have them open their hand, all the fingers, and just bring your fingers all the way in, like so. And that would be considered a 3. If they're able to do it against resistance, but then they break away, that would be considered a 4. If they're able to do it against resistance and they're able to sustain the contraction, that would be considered a 5. However, if they're unable to perform it against gravity, you can have them pronate their hand and then have them curl their fingers in. That would be considered a 2. If they're unable to do so, then you would be able to palpate the finger flexors up in the forearm. If they're able to pull it in, gravity eliminated, and you felt a contraction, that would be considered a 1. If there's no contraction present, that would be considered a 0. Finally, we're going to be going over supination and pronation for this exercise. In order to do this against gravity, you would have them open their hand up, have it flat against the gravity, and then you would ask them to move their hand against gravity and rotate it inwards. That would be considered a 3. If they're able to perform it against resistance, but then they break away, that would be considered a 4. If you're able to perform it against resistance and they're able to sustain the contraction, that would be considered a 5. Similarly, if they're able to hand down at their side, this would eliminate the whole part of gravity. If they were able to rotate their arm inwards, that would be considered a 2. If they're unable to do so, then you would palpate for the rotators in your upper forearm. And if you felt a contraction, that would be considered a 1. If there was no contraction, that would be a 0. Bringing it back to against gravity, if they're able to put their arm in the pronated position, and then you would ask them to supinate their arm, like so. If they're able to do it against gravity, that is considered a 3. If they're able to do it against gravity, but then they break away with applied pressure, that would be considered a 4. If they're able to sustain applied pressure, that would be considered a 5. If you were to eliminate gravity in this sense, you would have them put it at their side, and then you'd ask them to supinate. If they're able to perform this, that is considered a 2. If If they're unable to perform it, you would palpate the rotators, which are similarly down in the forearm, and then you would ask them to rotate. If you felt a contraction, then that would be considered a 1. If there's no contraction, that would be a 0.